Ladies and gentlemen, good morning, and welcome to the 2016 UCLA Healthcare Symposium. My name is Esme Henachor, and I am a second-year medical student at the David Geffen School of Medicine. I am one of 4 organizers of today's event, which is entirely student-run, co-sponsored by the Dean's Office, and has been put on every year for the past 20 years. Our search for this year's theme began early last year. The 4 of us brainstormed current topics that would inspire symposium participants to think in a new way about poignant issues in modern healthcare. After months of research and discussion, paired with input from our classmates and advisory board, we came to appreciate how the future of smartphone technology in the management of health and disease is both nuanced and provocative, and has implications for how we all experience healthcare and how we will experience it in the coming years. We acknowledge the expanding role of patients in terms of managing his or her own healthcare. We considered how this direct link between doctor and patient might impact the invaluable roles of all the other players on the healthcare team. We were thoughtful about how handheld technology might affect patient education in an extraordinary way and fundamentally change the way they experience healthcare delivery. With this symposium, we hope to catalyze discussion and challenge you to appreciate how your individual role is evolving in the new world of smartphone medicine. At this time, I would like to direct your attention to the table decorations, where we've displayed several cutting-edge health-related smartphone applications, many of which you can take a look at. I also wanted to tell you about the question cards that we put in the middle of the tables. And as the speakers present their talks, you can go ahead and write your questions and then put them in the mason jars. And our volunteers will be collecting these throughout the symposium so that they can help facilitate discussion through the moderated speaker panel. And finally, we received an incredible response to our pre-symposium survey. The results are intriguing, with half the room having never used smartphones or sensors for the purposes of health management. Even more striking is that an overwhelming majority have never spoken to their doctors about smartphone or sensor technology for managing their own health. Nevertheless, the room trends towards a positive view of smartphone sensor technology for health management. We are fascinated by these results and are excited to see if and how attitudes change after the conclusion of the symposium. So I ask that you make sure your phones are turned to silent as I welcome our faculty advisor, who was instrumental to the planning of this event. He truly has been there every step of the way, providing great wisdom and counsel. Dr. Clarence Braddock is the Vice Dean for Education at the David Geffen School of Medicine at UCLA and the Chief Medical Education Officer of the UCLA Health System. It is my honor to introduce him this morning to say a few words. Dr. Braddock.
Good morning, everyone. Good morning. Even in the digital age, we all want to interact with one another. And in fact, today will be a great day for that. We obviously live in a digital age. I've got my Fitbit. How many people have a Fitbit or something like that? So one of the things that's interesting we'll be able to explore today is how do we go from just this and this to actually leveraging technology in ways that can actually enhance health. This is a very exciting day to hear from our phenomenal speakers about what's happening as we speak today and the prospects for the future. I wanted to take a minute, though, to really congratulate and thank the student leaders and all the student volunteers here today. This is the 20th annual Healthcare Symposium. That's right, the 20th annual. And every year, second-year medical students show their leadership in really trying to stimulate conversation in the broader community about advances in healthcare. So Nora, Megan, Christina, and Azina, please stand and accept our thanks for a wonderful. Now, you have to know that this is sort of in their spare time because they're second-year medical students, which means classes every day, trying to plan for, this little thing called the boards, all kinds of things, but they actually have done a phenomenal amount of work. I can take really no credit except for meeting with them and saying, you guys go, but it should be a really fun day. The importance of technology is that it does provide opportunities for us. We think about this a lot in education and some of the things that we're doing to try and enhance teaching and learning through the use of technology. But I think what's really exciting is to think about how technology can really enhance healthcare delivery and really put control in the hands of all of us to enhance our own health. Out of curiosity, how many folks in the audience are healthcare providers, doctors, nurses, others, just get a sense? Very good. And others who are from the community, people who aren't, how many people are not in healthcare? Okay, good. So we've got a good mix. And I encourage, I think it'll be a great dialogue between those of us. We all are potentially patients. We're all concerned about our health, but some of us are also involved in thinking about how to deliver that health care and help promote health for all of you. So with a conference like this and the need for an MC, I really can think of no better person than Dr. Michael Pfeffer. Dr. Pfeffer is our Chief Information Officer at UCLA Health. He did his undergrad work at Brown, I think in chemical engineering. I've always had admiration when people did engineering undergrad. I did not. MD at Cornell, then did his medical training in internal medicine here at UCLA. He's a phenomenal leader, national leader in medical informatics with innumerable accomplishments. For those of you in healthcare, he led our implementation of our electronic medical record, which tells you a lot about his ability to drive change. But he also developed a very innovative program having physician informaticists and residents. Some of our residents actually are learning about medical informatics under his mentorship. Dr. Pfeffer, we're very grateful for you emceeing our program today, and I'm delighted to introduce you and bring you up to the podium.